that we provide and the lives that we're saving every day. So thank you all so much for taking time out of your busy lives to learn more about what it is that we do here at Bicycle Health. So I'd like to go over just a couple of disclosures before we get started. So firstly, please know that this presentation is being recorded for quality assurance and training purposes. Secondly, this presentation is not intended to provide any type of medical advice and is only intended to provide the public with an overview of Bicycle Health, our program, and how it works. So during this open house, we will offer individuals suffering from addiction and their loved ones an opportunity to connect with providers, recovery coaches, and other staff of Bicycle Health from the comfort of your own home. Attendees of the event will gather information from speakers regarding program details, what Suboxone is, how it works, and the success rates of patients using Suboxone for their recovery next to other treatment methods. Attendees will also learn about Bicycle Health and our services and what sets Bicycle Health apart from other addiction clinics. So our agenda for this event is as follows. I'm going to begin by giving you all an introduction to Bicycle Health and how and why Bicycle Health was created. I'm then going to bring on our guest speaker, Melanie Phillips, to talk with us regarding the best ways a loved one can support an individual who happens to be going through opioid use disorder. We will also hear from a Bicycle Health clinician and a member of Bicycle Health's care team to discuss what Bicycle Health's managed patient care looks like while being an established patient. Another topic that we'll cover will be the process, what the process looks like to enroll into the Bicycle Health program. From there, we'll go through a brief tour of the Bicycle Health app, where you'll be able to learn how the app works, what it does, the different functionalities, and just how user-friendly it is. I'll then conclude the open house with some time for some questions from you folks. So if you do happen to have any questions or concerns along the way, please feel free to utilize the Q&A functionality within this Zoom meeting. And one of our top enrollment coordinators, Robin Carter, she's with us to help answer your questions. We also have Q&A help from Gina Bompadre, one of our clinical support specialists, and Dr. Julie Craig, one of Bicycle Health's top clinicians. If you notice the image to the right, all you need to do is select the Q&A icon listed toward the bottom of your Zoom video, and a Q&A pop-up should appear, enabling you to type. And in case you're wondering, no worries, you have the option to send questions anonymously. So why are we called Bicycle Health? Well, when our founder was developing our organization, he found a lot of similarities between addiction recovery and riding a bike. You have your uphills, you have your downhills, you can move slow, or you can move fast, depending on your choice of speed of pedaling. Many times you start out with training wheels until you feel comfortable riding your bike without them. Sometimes without those training wheels, we fall off the bike, and that's okay. The goal is to just get back on the bike, keep going, and not let that fall deter you from riding the bike. So Bicycle Health started about 5 years ago by our founder and CEO, Ankit Gupta. An engineer by training, Ankit wanted to create technology that had impact and meaning, and realized that there was a huge need to help people suffering from addiction. At the time, fentanyl and other opioid addiction were skyrocketing. So the organization decided to focus on treating opioid addiction specifically. After spending several months connecting with people in recovery and listening to their stories, Ankit began building the Bicycle Health treatment program. So Bicycle Health began as an in-person treatment center in Redwood City, California in 2019. The first clinic had about 8 staff members and about 150 patients. The clinic was successful, but just to make it easier for patients to access care, the organization decided to start seeing patients via telehealth, as well as in person. It quickly became apparent that much of the stigma that came along with addiction evaporated in the telehealth environment, and it became much easier to positively impact the lives of patients. Telehealth made things like caring for children or an elderly loved one much easier, and it also made it easier for people to stay employed and seek treatment that fit their work schedules. Travel often impacted treatment as well, along with privacy concerns. Telehealth fixes all of this. So what is telehealth? Well, telehealth is the delivery of healthcare remotely by means of telecommunications technology, meaning telehealth allows a healthcare provider to care for a patient without an in-person office visit. When COVID-19 hit, Bicycle Health adapted to a telehealth model and never looked back. Maintaining a telehealth treatment model has been a game changer for our patients. It enables us to provide high-quality treatment from anywhere in the country. In just 2.5 years, Bicycle Health has gone from 8 staff members to almost 300. We've gone from serving patients in just 1 state to being licensed to treat patients in 32 states. And most importantly, we've gone from around 150 patients to more than 20,000 patients. Our current retention rate after 30 days is 86% for insured patients compared to an industry average of 69%. Our current retention rate after 90 days is 80% for insured patients compared to the industry average of 44%. The no-show rate for Bicycle Health patients is 9.5% compared with 23% as the industry average. And the current age range of our patients is 18 to 77 years of age. Bicycle Health is HIPAA compliant and is one of the only telehealth companies that employ full-time clinicians and on-call teams. In 2022, Bicycle Health was listed as one of Time Magazine's most influential companies. Our mission is to increase access to quality, affordable, convenient, and private opioid use disorder treatment for all. And our vision is to enable anyone with a chronic disease to live a healthy and fulfilling life. So, as mentioned before, we are currently licensed to treat in 32 of our 50 states. The green on this map indicates the states that we are presently active in, and we are working diligently to get the rest of this map filled up with green. So let's get into it. I would like to introduce to you all Melanie Phillips, who happens to be one of our fantastic recovery coaches here at Bicycle Health. She's going to speak with you all, not just about opioid use disorder, which is sometimes referred to as OUD, but also about how loved ones are affected by this disease and how loved ones can communicate with and support those suffering from addiction. Thank you so much, Melody, for joining us tonight, and feel free to take it away.
Thank you, Kyle. So working in the field and having the opportunity to speak to patients, we do find 2 very common topics regarding loved ones. One is how can we support our loved ones that are struggling with substance use disorder? And we're briefly going to touch on suggestions for those in recovery or have a desire to do so, how to cope with loved ones that may be apprehensive about your recovery goals. So when we think of supporting loved ones with substance use disorder, it comes with its own challenges. There may be many factors that play an important role in offering support. We will discuss some things to keep in mind when providing support to loved ones. It is important to gain knowledge for substance use disorder before we reach out to a loved one we suspect that may be struggling with it. In order to reach out to our loved ones, we want to come from a place of empathy and understanding. And to do this, it requires that we understand ourselves and acquire the appropriate knowledge. So you may want to take time to understand what substance use is and the effects on the brain. You can learn about the multiple pathways to recovery, and And you want to understand that every shoe may not fit every person. So keep in mind also that listening to success stories can give you the hope you need to continue to be supportive. Some examples of some things you may want to research would be, what is substance use disorder and the signs that your loved one may be experiencing it? What's the science behind substance use disorder? What are the multiple pathways to recovery? And again, you can find various stories on the internet of people who were able to continue in their recovery and have a wonderful future. These are a few links for some websites that you can look into. There's a National Institute of Drug Abuse, a partnership to end addiction, and then CCAR has some examples of the multiple pathways in recovery. So we've all heard the saying that if you can't help yourself, you can't help others. We want to especially practice self-care when it comes to dealing with our loved ones and wanting to be supportive to them. We have to show up for ourselves. It's easy to get wrapped in your loved one's life and you can neglect your own needs. But taking the time out for yourself will help you to be more equipped to really be present and supportive of your loved one. Keep in mind that self-care looks different for everyone. We want to remember the essentials to stay hydrated, get plenty of rest, make sure you're eating nutritious meals, talk to other loved ones, get the support you need, and get active. And then you also want to take time for hobbies or things that you love. And that's where everyone's self-care looks different. It may be reading, journaling, whatever it is that that helps you to feel better and, something that's just for you. Next, we have get outside support. So there are support groups and then there's one-on-one therapy. Some people really like support groups because in that time they're able to connect with their peers and they're able to, be able to discuss the different problems and situations that they may be experiencing. And then therapy is great also in addition to support groups or alone, but that's a good chance that you can speak to someone about how you feel and what's going on and help you to also process through a lot of those things. It's also very important to set boundaries. Boundaries are necessary in all relationships. In the case of boundaries with loved ones with substance use disorder, want to keep in mind boundaries are not there to control the behavior or the thoughts of the loved one, but healthy boundaries are going to help people define who they are as a way to ensure relationships are safe, supportive, and respectful. Unhealthy boundaries are thoughts or behaviors used as a means to manipulate or control relationships to keep people away. So just want to keep in mind also the importance of setting boundaries. And lastly, we want to be patient. We want to keep in mind that everyone's recovery journey is different. There's going to be ups and downs and setbacks, and we want to be as positive as possible. We want to keep in mind that recovery is not something that happens overnight. Some people, again, they try at recovery multiple times throughout their lives. Some people may never return to use, but despite the number of attempts needed in the journey, patience will help you as the loved one to deal with the ups and the downs that they may experience. At the end of the day, we want to be positive and hopeful that our loved ones can and will fight this battle and be successful with their recovery goals. For anyone that is in recovery or has recovery goals, we want you to know that you can do this. There are some instances we find that some patients have loved ones that are apprehensive about their recovery, and this could be for various reasons. Examples could be loss of trust, or maybe this isn't your first attempt at recovery, but whatever the reasons for your loved one's feelings, we want to keep in mind that your loved ones may have these feelings because of something that hurt them. And remember to have grace for yourself as well as your loved ones. This is a process. It may take a while for them to see and believe in the changes that you're making in your life. But in the meantime, you want to work on your own recovery and learn to forgive yourself and heal. You never know when your loved one will come around and start seeing how far you've come. Above all, regardless of what your loved one chooses, remember again, this is your journey. And if you're here listening today, congratulations on making another step for your future. Thank you all for your time.
Terrific. Thank you so much, Melanie, for that really, detailed information. I think fighting addiction is not an easy process, nor supporting someone going through addiction. But, hopefully your advice and your tips that you just provided will help others. So thank you so much again for that, and for being part of this event. I appreciate it. So I would now like to bring on one of our top clinicians, Dr. Julie Craig, and one of our clinical support specialists, Gina Bompadre. Dr. Craig is going to speak about our clinical model and touch on what Suboxone is and how it works. Gina will then take over, and she'll be speaking with you about what it is like to be an established patient with bicycle health. So without further ado, I would like to introduce you all to Dr. Julie Craig.
Good afternoon, I guess evening in some parts of the country. I'm Julie Craig. I'm the Pacific Regional Medical Director, and I am a medical doctor with a board certification in both family medicine and addiction medicine. And I've been with Bicycle Health for about 2 years now. I'm going to talk just a little bit today about the medication that we use to help people with opioid use disorder. So primarily we use Suboxone in its brand or generic form. Suboxone is a combination of 2 medications. Buprenorphine is the active ingredient, and there is naloxone, which you may recognize as the active ingredient in Narcan, which is used to reverse opioid overdoses. And naloxone doesn't do a whole lot if one takes Suboxone appropriately. It just kind of, it actually is not absorbed at all, but it does prevent people from injecting Suboxone because it can cause severe and sudden withdrawals if it's injected. So the buprenorphine part of this whole medication is what's called a partial opioid. So it fills the opioid receptors, but does not fully activate them. So it kind of settles down or satisfies those opioid receptors so that patients don't have cravings or withdrawals when they're taking it. The advantages of buprenorphine over all the other opioids is it's safer. It's very hard to overdose on. When we see overdoses, they usually involve sedatives like benzodiazepines, but even with that, we generally don't see overdoses with Suboxone. And I think one of the major things we get out of Suboxone is it's long acting. So instead of having people need to dose something like fentanyl, which is short acting, several times through the day, people can take Suboxone and forget about it. For up to 24 hours, most people can dose once a day. And it does not cause the tolerance we see with opioids. Tolerance is the need to have more and more over time to get the same effect. So anybody who's been on Percocet for a couple of months after a surgery or something knows that that's at the start, you take 1 and it works, and that's all good. And after a week or so, you need 2 to work. And after more weeks, you need 3 or 4 or 5. Suboxone's not like that. If we can find a dose that works, that dose usually stays the same, unless there's something new, like an injury or a new disease or pain-causing issue. Now, there's a disadvantage to Suboxone. There's always risks to any medication. And the main disadvantage is it does maintain the physical dependence. So if somebody stops Suboxone quickly, they're going to feel it, and it's not going to feel good. It's going to feel just like opioid withdrawal. So that's kind of the balance, but this is the medication that we use in order to help people who are struggling with minute-to-minute opioid needs, opioid withdrawal, to stabilize and live the life that they want to live. Excuse me, I'm losing my voice today. Kyle, if you want to go to the next slide. Kyle. There we go. So the medical model is essentially that we use medication to assist with opioid use disorder. We know that medications for opioid use disorder save lives. Methadone and buprenorphine are both evidenced to be life-saving. We make treatment accessible and convenient by doing that treatment by telemedicine. So we see patients who are already on Suboxone and are coming to us to get Suboxone. We work with them at the time frame that they need to be seen at. For example, if somebody's really struggling, we might see them every couple of days. And if somebody's really stable, we move on to weekly, biweekly, and eventually usually monthly visits. Go ahead, Kyle. And I'm going to turn it over to Gina.
Awesome. Thank you, Julie. Appreciate all that information. Gina, why don't you talk with us about what it's like to be an established patient here at Bicycle Health?
I sure will. Thanks, Kyle. Thanks, Dr. Craig, Melanie. Hi, everybody. My name is Gina, and I'm a senior clinical support specialist here with Bicycle Health. And I'll get into more of that in a moment. But as a clinical support specialist, I actually get to witness the incredible accomplishments of our patients, by going through this program. Our patients are able to live their lives, maintain employment, get promotions, rebuild relationships. Having this program via telehealth allows you to have your appointment in the comfort of your own home and at the days and times that work best for you. After you've enrolled into the program, you've had your first appointment scheduled, you're going to get a link to download the Bicycle Health app. This app is all you need to have your appointment and reach your care team like us. Behind the scenes, we, the clinical support specialists, we're calling your pharmacy to make sure that they have stock in your medication. Our goal is to make this transition as seamless as possible for you. So by locating the medication ahead of time, it prevents a delay in your induction and reduces the time spent trying to go back and forth with your care team. Now, you've had your first appointment. You did it. Congratulations. We know what a huge step you just took, and we are so proud of you. Your provider went over everything with you during your appointment, how to start the medication, and likely gave you an induction plan to reference. If you have any questions about this or anything else, the app is the place to reach us, the clinical support specialist, also known as your care team. Have you ever been to a doctor's office and the nurse, medical assistant, they call you back, ask a bunch of questions, get your vitals, and then you are seen by your provider? Well, that's us. Every patient is assigned a care team, and we can help with 90% of whatever questions that you have. Once you're established, we can help schedule follow-up appointments, check stock at different pharmacies, address pharmacy or prescription issues, create treatment verification letters, troubleshoot urine drug screen questions. We update your personal informations, and also we can answer questions about medication interactions, and the list just goes on and on. Of course, if we need to reach out to your provider for an urgent medical issue, we absolutely do. And you also have access to reach your provider as well. If your provider's out of the office, there are on-call and covering providers available. While we are behind the scenes, we are also here to support you. We listen to your concerns. We celebrate your successes, but we also hold you accountable. Now, your care team is not only comprised of medical personnel like your provider and the clinical support staff, but it also includes highly innovative tech support and an engineering team that's always looking for ways to improve the overall app experience. In the age of technology, things happen, right? This highly skilled team is here to help resolve these unforeseen tech issues and get things back on track as quickly as possible. We also have a dedicated financial management team, whether you're self-pay or an insurance patient, to make sure your billing is accurate and as painless as possible. We do understand things happen, life comes up. When you reach out to us in the app, we are able to send requests to the finance team, like changing a billing date, for example, and so many other financial related issues or questions. Now, MOUD, the medication for opioid use disorder, it's not only about medication, but it also involves treating the whole person, which includes our mental health. And because of this, you also have access to a one-on-one licensed therapist. You have access to group therapy, peer-led support groups, and care coordination. Some of us have been where you are, and some of us are on the outside looking in. If you're not comfortable at first talking with a therapist one-on-one, go to a support group or a group therapy session and just listen. There are so many different groups for all walks of life, whenever it's convenient for you, every day of the week, all hours of the day or night. Every single person in there has their own story, and it just might resonate with you. Maybe your story can help someone else. I always suggest just try at least one. You just might find it helpful. I hope to see you in the chats.
All right. Thank you so much, Dr. Craig and Gina. You are both so appreciated with all the information that you give. Thank you so much. So our final speaker of this evening is going to be the talented Robin Carter. Robin is going to go over Bicycle Health's enrollment process with you and talk about just how easy it is to join the Bicycle Health program. Go ahead and take it away, Robin.
Thanks, Kyle. Hello, everyone. My name is Robin Carter. I would like to go over Bicycle Health's enrollment process with you. I'll go over the different options we have to enroll into our program, and then I'll go over the additional steps needed to become an established Bicycle Health patient. So to start, we have multiple ways you can choose from to enroll into our program. From our website, you can actually find a chat functionality that will connect you with one of our enrollment coordinators, and they'll walk you through the entire process. Also from our website, you have the ability to go on and schedule the perfect time and date for one of our enrollment coordinators to reach out to you. Or you can choose to enroll through our self-service option, which would involve you filling out an intake on your own and having an enrollment coordinator reach out to you once completed. Or you can just call straight into our phone lines. Once you connect yourself with an enrollment coordinator, the coordinator will introduce themselves, go over the program information, as well as answer any questions that you might have. They'll speak with you about our $199 monthly rate, which covers all doctor's visits for that particular month, access to online support groups, access to a care team, and all of your urine drug screening kits. Once questions are answered, the coordinator will go through about a 10 to 15-minute health questionnaire with you. This questionnaire will help us gather basic health information on you to help determine if Bicycle Health is going to be a good fit for you and that you'll be a good fit for Bicycle Health. Of course, all information gathered will be kept completely confidential. During the questionnaire, the enrollment coordinator will also go over billing options with you, such as if you have insurance or if you're going to be self-pay. We are able to accept many commercial insurances, and in some states, we're able to accept Medicaid and or Medicare. Once you get that questionnaire completed, the enrollment coordinator will electronically send you the paperwork via a text or email that will need to be filled out. These are just standard forms that you'll fill out when you go to any kind of doctor's office. There's a consent to treat form, a financial agreement, as well as a couple HIPAA forms in there for you to fill out as well. Also, you'll need to upload a photo of your ID. And if you're paying for treatment with insurance, you'll need to upload an image of your insurance card as well. At the time we receive your completed paperwork, we can then get your appointment scheduled. We will first book your initial appointment. This appointment is going to be an hour long, so you do want to keep that in mind. After we book your initial appointment, we'll then book your 20-minute follow-up appointment. And this appointment is simply so that your provider can check in on you, see how you're doing, feeling, things like that. Your follow-up appointment will be scheduled anywhere between 2 to 7 days from your initial appointment. Alrighty, final step. So now that appointments have been scheduled, your paperwork will go into processing. Our enrollment team will assist you through the registration process and ensure that everything is set up for your first appointment. Once our team has finished processing all paperwork, they'll go ahead, send you the Bicycle Health app to download onto your phone, and all you'll need to do is just wait for your appointment date and time.
Awesome. Thank you for that run through, Robin. Super appreciate it. We at Bicycle Health, we certainly do our best to make joining our program as easy and seamlessly as possible. And thank you for taking the time to go over that with everyone. Super appreciated. So it's almost time to get questions from you folks, but before we start doing that, we would like to just take the next few minutes and give you a brief demonstration of our Bicycle Health app, just so that you can see its functionalities, its simplicity, and really just how easy it is to use and navigate. So enjoy this brief little video that we've got here.
Welcome to the Bicycle Health app. The first tab is the home screen. It shows me everything I need to know about what's coming up with my treatment. I can see my upcoming appointments as well as any clinical tasks that have been assigned to me by my provider. We'll talk more about clinical tasks in the second part of this video. In the Appointments tab, I can see all past and upcoming appointments. Throughout the Bicycle Health app, I can contact my provider or a member of the Bicycle Health admin team anytime by tapping the chat button in the bottom right corner. In-app chat is organized into channels, so I can direct my question to the most appropriate team. In the Meds tab, I can find up-to-date info on my current prescriptions and preferred pharmacies. Under the Resources tab, I can access my account information and settings as well as information and tools. I have an appointment coming up, so I'm going to test out my microphone and camera. Looks good. Now I'm just going to make sure all my app permissions are set up properly. If I have any questions, I can open up the FAQ section and browse through to learn more about different parts of bicycle health treatment. Finally, I can update my payment information and confirm that all my contact info is correct. At this point, I can join the video call from my appointment. I can join the video call up to 30 minutes before my appointment is scheduled to start. If, for some reason, I get disconnected from the video call and I want to rejoin, I can do that by tapping the Rejoin Appointment button. During my visit, my doctor told me about support groups that are hosted by Bicycle Health, recovery, coaches, and therapists. I can access those support groups from the home screen as well. If I scroll down, I can see a listing of available support groups and any of the ones that I might have signed up for. Support groups are group video calls that happen on set days and times. I can browse through the list on the home screen and find support groups that are most convenient for me. If I join them, I'll receive reminders when they're about to start. All I have to do to jump in one is open up my home screen and hit the Join Video Call button. When I join a support group, I know I'm going to be joining a video call with other peers who are also going through recovery. The Bicycle Health app lets me set my privacy settings to choose how much of my full name, if any, I want to display to other peers in that support group.
All righty, perfect. We would like to spend just the last few moments here being able to answer any questions that you folks may have on your end. So if you have any questions, again, please post them in the chat and our team will do our best to provide you with all the answers that you need. And just a reminder, you have that little Q&A icon down at the bottom of your screen there. And just if you tap that, it should enable you to type whatever question that you have. And again, you do have the option to submit your questions anonymously. So please keep that in mind as well, okay? So we'll go ahead and start answering some of the questions that have already come through.
I can take that first question. So essentially the question is, do I have to go to a pharmacy or a clinic every day? So what's being described there is something called an OTP, opioid treatment program, which is a very general term, but it's actually a phrase for methadone clinics where they dose at the window every day. And then when you've been there for a while, they give you take homes. Now, methadone clinics have started doing buprenorphine, Suboxone at the window also. And again, you have to go every day until you've been there for months and then get take homes. And that's actually maybe going to be reformed at the federal level. We are not an OTP. We are roughly what's called an OBOT, opioid, or excuse me, office-based opioid treatment program, which sounds exactly the same, but it's actually a little bit different, in that we do prescriptions. So the prescription goes to the pharmacy, pick it up there. Now we see people fairly frequently in the first few days to weeks, depending on the person. Somebody comes to us from a program and they're already on Suboxone, they've been stable for a year, they're not going to be seeing us every couple of days. But somebody who's trying to make a transition from fentanyl, which can be quite complicated, we might see people every couple of days, make sure they're okay. Once we start getting drug screens back, we go from roughly weekly visits or more if needed to every other week. The second drug screen, we go to every third or fourth week. And most people are eventually on monthly visits. There are reasons why that might not be. If somebody's struggling with a secondary substance like alcohol or methamphetamines or something like that, we might see people more frequently. Or if somebody has mental health issues we're trying to assist with, trying to get anxiety under control, trying to get depression under control, we might see people more often. Most of our patients who are doing well are being seen monthly, and that prescription goes to the pharmacy. The person picks it up and they have that month of prescription. They do not have to go every day. That's very rare. I hope that's a thorough enough answer there. If you have any more questions about that, please feel free to add them. I'm going to go on to the next one though, which is New Hampshire is looking really weird on that map. I didn't look at that until you said so, but I agree. It's not exactly what New Hampshire looks like on that map. The same person asked, what would be some of the most common things that would make a patient not a good fit? So most of the things that make patients not a good fit are safety issues. So for example, if somebody is using opioids and alcohol, which is a dangerous combination to start with, we can help with the opioid issue, but alcohol withdrawals themselves can be quite dangerous. So if somebody's, had a seizure with alcohol withdrawal, and we're trying to treat their opioid issues, we're generally not going to take that person into telemedicine until they are settled down in a detox situation. So a lot of times it's a safety issue. Sometimes it's a mental health complexity issue. If somebody is, frankly delusional, seeing things, hearing things that aren't there, that aren't recognized in the reality that the rest of us are operating in, that's something that takes a little bit more than we can offer. So oftentimes people with those issues, which is usually schizophrenia or bipolar disorder, again, will need psychiatric stabilization before we can engage with them. And then there's other things like some people don't do well with technology, have a hard time logging into the app and getting drug screens done. That's kind of a softer call, but it is a reason why some people thrive better in an in-person setting. I think that was the same question asked again, roughly. Let me see what else is there. We really do use the app, and same person's asking. We don't have right now a desktop or laptop form of the app. We very rarely use phone calls alone, partly because for regulations and billing, that's not really allowed to just speak by phone. So we do try to always have that video interface on. It is done through Zoom and in a protected, HIPAA appropriate, that is to say privacy appropriate environment, but we really do use the app for almost all communications, including just chat communications. If somebody is, day 2 into trying to get onto Suboxone and they're struggling, they can send a message through the app saying like, hey, I need to talk to a provider about what to do here. But we really do stay with the app as far as most communication goes, including video and chat functions. Let me see, I don't know if there's any other, let's see. Yes, I'm not a tech person by any stretch of the imagination, but yes, I'm quite sure that iOS and Android, they're compatible with both. You don't have to have an iPhone to be, nor do you have to have an Android to be on our app. What metrics do you use to measure success in your program? That's a really good question. So one of the industry standards for measuring success is retention and treatment, which is a proxy for a lot of other stuff, including, the ability of people to stay off illicit opioids and things like that. So that's our primary metric. We also have metrics like engagement with mental health support. We don't require counseling. We are building out a counseling program, but we don't require it right now, but we do want people to feel welcome and comfortable and engaged with recovery groups or individual therapists. So one of our success measures is really screening people for anxiety, depression, ADD, other things that kind of play into opioid use disorder, and to treat those things when we see them, to make sure that people are getting that kind of support when they need it. Let's see. I think I know what this question means. It says, "Will the end of COVID and telehealth?" Oh, I think it's supposed to, will the end of COVID and telehealth options? Thank you for your previous inquiry. So the thought is no. So there's some pushback, there's some rollbacks of some of the things that were allowed, especially in the very beginning of COVID. One of the things that was allowed back then was anything by phone. I was working in primary care at the time, and we could do anything by just getting in touch with the patient and just making sure that they had what they needed. That has become much more formalized, which is important that those regulations be well thought out, not crisis based. But there are some positive moves at the federal level to make sure that people have access to opioid use disorder treatment. One of the positive moves, which is not exactly related to COVID, but they've removed the cap on the number of patients that we can see. So historically, providers had to do 8 hours of training, 24 hours of training if they're a nurse practitioner, to get a special license to write Suboxone. That has been removed so that any provider can write Suboxone and can help with opioid use disorder. That's not to say that every provider will be comfortable with that. But there are really good moves at the federal level to remove regulations and to allow telehealth to go forward and to support opioid use disorder treatment, recognizing that it's a nationwide crisis right now. I think that's the last question I see. Any of the folks, so there's 2 folks who posted those. Any other questions or follow-ups there? Keep an eye on the chat here. I'll turn it back to you, Kyle. Are there any other questions that you're seeing?
Yeah, no, I think we're definitely good to go. If any questions roll in within the next few, seconds or whatever, then we'll certainly address them. But I mean, at this point, I suppose if we've answered all questions that you folks have, our time has come to end this open house. So if you do have further questions, definitely send them along to, we have an email address you can send those to. That's openhouse@bicyclehealth.com. And again, just to say that again, openhouse@bicyclehealth.com. And we will get back to you as soon as possible. If you are interested in enrolling into our program, or if you know of anyone that would be interested in enrolling into our program, you can give us a call at 844-943-2514. And I'm just going to read that one last time, 844-943-2514. You can also visit our website, bicyclehealth.com, where you can review the other enrollment options that Robin spoke about, such as our chat enrollment, which seems to be really popular right now. But yeah, so I just want to take a moment to thank you all so much for taking the time to learn about bicycle health and what we're all about. I would also like to thank everybody involved that assisted with putting this event together. Thank you for all that you guys do. And for the hard work and dedication that you put in to make this happen. So it's super appreciated. I hope all of you have a fantastic night. Everybody, please be safe. And thank you so much for your time. Go ahead, Julie.
I think we actually have one more question popped in.
Oh, let's hit that.
Would you like to go ahead and ask a question?
Yeah,
The question is, how is the UA done?
Okay. That's a really good question. So
yeah.
we do place a lot of trust in our patients, and we also understand that sometimes when things are not going well, it's not the urine drug screen that tells us that, it's their behavior, the ability to make their medication last the appropriate amount of time and to attend appointments on time, things like that. So we do send urine drug screens out to our patients. That's part of the cost of the whole program. And we ask them to do them on a random basis. So our system generates a date, spits out a date every 30 days or every 14 days for new patients. And it's due within 24 hours of that time. And it's uploaded as photos through the app that are real time. So it's very difficult to pull photos like off a phone and try to upload them. We've also become very expert in sussing out the very fine details of, does that cocaine stripe look quite right? Or is that fentanyl positive or negative? That is a lot of trust in our patients. And we do have ways of sort of backing that if there's concerns. One is oral screens. So that's a cheek swab that is done in front of a provider and then shown right there. And we also sometimes send people to a lab to confirm if we're concerned about something. And that's usually pretty targeted. If somebody's turning up like a positive benzo screen and it might be their antidepressant or something like that, the lab can sort that out for us. So we do a very specific check on that. So we do have ways of doing that are in the comfort of your own home as part of the cost of the program. And also at times we have to step out of that to get more accurate information, but we are inevitably here to help. So if somebody is struggling with something else, we'd rather know about it and assist rather than struggling with, missed appointments and other issues because there's a methamphetamine issue that they're not talking about. So we would always rather know and use whatever evidence-based medicine exists, which is not a lot for methamphetamines, but there are some things out there that can help with the cravings and help get people on track. So we would always rather know than try to catch somebody at something. That answers that. I'll turn it back over to you, Paul.
Yeah, no more questions? Okay. All right. Well, like I said, if any other questions arise, feel free to send us an email at openhouse@bicyclehealth.com. And I hope you all have a very safe evening tonight. Thank you all again for attending. Very much appreciated. Bye-bye.